Hi, Nikki.
Hello, hi, good afternoon.
Thanks so much for agreeing to this interview. Nikki, can I ask you to introduce yourself first, please?
Sure, my name's Nikki Fox and I'm the health correspondent for the BBC in the east of England.
Thank you. I've got 4 questions for you, and this is the first one. The first one is, how are you looking after yourself and during this pandemic, and how is your team being supported?
Well, like the rest of the health sector, the BBC has been working throughout the pandemic, so we've had to adapt really quickly to the changes that have been implemented. So in the office, for example, it's a very, very different working environment. We've got a one-way system around the whole office because it's open plan, and only people that really work on the programme that day are now based in the office, so everybody else is now working from home. We've taken out a lot of computers to allow for teaming to distancing, and we've completely reworked the TV gallery. So there's been a lot of technical reworking and a lot of work for the engineers. A lot of people are at home, so they've been really good here, and they've organised weekly coffee catch-ups on Zoom for people who've been working at home, because they can feel quite socially isolated. I mean, some of them are shielding, like members in the wider community, and some of them are just working from home because they're not involved in the programme. So we have that weekly session where we can all just log on and talk to each other with a coffee or a cup of tea, and not talk about work. Actually, we just catch up on what's happening to people in their general lives so that they don't feel isolated and they still feel part of the team. And one of the other reporters, Robbie West, as well, he organises quiz nights. So often on a Sunday night, we've been logging onto Zoom to do work quiz nights, and that's been really, really great. It's sort of brought us all together, and we are a much closer team actually throughout all of this. So that's been really good. And the way we edit out in the field as well has changed a lot. Safety is a #1 priority. So where we used to edit together, for instance, on a laptop in the same car, now we edit in different cars, and we join on a Zoom meeting, and so one person observes it on Zoom, and they can see how the other person is editing so that we stay socially distanced. And then what we do is we have a microphone on a stand outside the car, wind down the window, and that's how we do the voiceovers. So it's all very, very different. But it's been a challenge. However, it has, as I said, it really brought the team together and made us think about the way that we do things. So on a personal note, I have a 3-year-old daughter, and I have been trying to make sure that, you know, I spend plenty of time with her. Because we haven't got the rushing around visiting relatives, that's actually been quite nice. So we found lots of woodland walks, and we've done a lot more reading. And I have been trying to spread my leave because it has been a busy time. So I've just taken a week and a half off just to get a bit of a break in case the second wave comes. Hopefully it won't.
A lot of adapting and looking after yourself, that's great. And I like the fact that you get to know each other more as well. I won't ask how you did it at the quiz, that we'll keep that private.
Pretty poorly.
Well, Nick Hume said he finished his last in his quizzes, so you know he was being very honest. My second question is this: so, how has the BBC made changes to its coverage during the pandemic?
Well, I think to start with, it was very much putting across public information. So I'd normally be out reporting most days, but a lot of the time I was finding that I was actually in the studio doing more segments like Your Questions Answered, which basically meant that we were answering people's questions on the rules. There was a real thirst for knowledge at the beginning of the pandemic, and there were questions like, you know, can I drop off a meal at an elderly relative? Can I use the bus when I'm a key worker? So we brought in a lot of experts, and I found myself a lot of the time just, you know, answering people's questions rather than investigating anything or reporting. But then as the pandemic went on, it was really, really important to tell people what was really going on in the health service. For the safety of workers, some things needed raising, like the shortage of PPE and the testing issues. but also just telling people what was actually happening. And there was a real balance between knowing when to go out and report and when not to stay in and keep people safe, because it just wasn't necessary. For instance, some hospitals didn't really want us in while they weren't allowing relatives in. They made that decision because they thought it just wasn't fair on the relatives. But the thing about television is that pictures really stay in your mind, and people really do listen to sort of lasting images that they form in their minds. When you're a child, you know, it's much more easy to remember a story with pictures than it is words, and that's how people learn to read. So I think that's why. And Papworth in the end led us into their intensive care department, and I think that was really important, because in 20 years' time, it'll be those pictures that people look back on in this pandemic. The pictures of the nurses having to wear their masks in their full gowns, the pictures of people being swabbed in cars. And so we did go out to do these pieces, but we had to just make sure we were doing them at the right time. We did also make sure that we did a lot more reporting online. So we would interview people on Zoom if they were shielding. And I think that's something that will probably carry on in the future. So yeah, a lot of changes, and I think a lot of those will continue in the future.
It makes sense. I think everyone's learned to use online facilities far more. In fact, the health digital transformation process has jumped about 3 or 4 years ahead of schedule because of the pandemic.
Yeah, I think 6 months ago, nobody knew what Zoom is, did they? And now we're using them to do things like Facebook Live. So after one of the, each of the important government announcements, the daily briefings, we tended to do sort of a Facebook Live online rather than on the television. And that really, really took off, because people's thirst for knowledge was immediate. You know, it was a bit like radio on the television, but it's what people wanted. They wanted answers to the questions, and one of those got over 1 million views. So I think we'll definitely take that forward into the future and do more of that online.
Okay. Thank you. Right, so my third question is, how has what you've seen had an impact on you?
Well, I think the big one was going into the intensive care department at Papworth and just seeing the nurses and the bravery. Just seeing the difference in how busy they were compared to how busy they usually are. It was unbelievable, really. I mean, seeing the people's ages, the fact that a lot of them were in their 40s, they were very young, lying there in induced comas, that really was a wake-up call. And I think that was so, so important to report on, because people can sit there all day and listen to politicians at the daily briefing, but they don't realise the enormity of the situation unless they realise the consequences of what happens if they don't listen to the information. So that really hit home, just the processes they have to follow. They took me through taking off and putting on the PPE, and they had to be very careful, obviously, because they didn't want me to catch it. And just the way that they had to make sure we didn't touch the taps, go through the whole hand washing process, how they put on their PPE, how they had almost scars on their noses because the PPE masks were rubbing constantly every day. How they had to write their names on their gowns, because usually they could speak to each other, but because of the protective equipment they had on, they didn't know who they were talking to, so they just relied on the writing on their gowns to know who they were actually talking to. And one nurse as well, I think it was just the commitment of the staff that really got to me, because one nurse just said to me off camera, she said, "Nikki, we just don't want to die." And that really brought it home to me, because, I spend a lot of time interviewing chief executives and leaders in the healthcare industry, but when you speak to nurses on the ground and they say things like that to you, you realise, well, yeah, I mean, they're not getting paid a great amount of money. They're going in, they're doing their job, they're not complaining, and they just want to be protected. And that's why the whole PPE issue is really, really important, and that will always stick with me. The other things were, unfortunately, the people who did lose their lives, the healthcare workers in Southend. A couple of months ago, there was a service where they did a silence and they placed a number of shoes on the grass, which reflected the number of healthcare workers that died. That was really poignant. A lot of those had lost colleagues. But there's some really positive things that I've noticed that will stay with me as well. The clap, for instance, we did that in our close where we live, and it really brought all of us together, the whole close. Our neighbours, hadn't spoken to them too much before, and now we speak to each other loads because, every Thursday night, if I got home on time, we'd go out and do it. And, seeing that all over the region was really, really heartwarming. And I know the University of Suffolk, for instance, is now seeing a rise in applications from nurses. They're seeing a big rise. And I think people do now have a lot more respect for healthcare workers. And I think that's one of the real positives, along with the community spirit, that have come out of this. So, yeah.
Absolutely. I mean, it's good to consider the positives and the way the community has come together as well. You talked about the visual appearance of the hospital when you were there at Papworth. Did you feel an atmosphere?
Yeah, I mean, I just felt an atmosphere of commitment and hard work. It was an atmosphere of focus, actually. Everybody just got on with their jobs. They knew what they were doing. They had the procedures in place. I didn't get any kind of atmosphere of worry in there. It was just what she happened to sort of say to me when we were chatting outside the department. But inside the department, no, it was just pure focus and dedication, and they just wanted to help. I mean, some of the people inside that department, they weren't regular intensive care nurses. Some of them were just people that had been doing diagnostics, or they'd been doing ECG tests for outpatients. They'd not done that before. Some of them were quite young, some were medical students, and they just got on with it. And I think that's truly admirable that our health service can pull together and do that.
Lovely to hear. Thank you, Nikki. So on to the last question. It's the future. What learning do you think will come from this outbreak?
Well, I think as far as our working goes at the BBC, it will drastically change. I think that we'll be doing a lot more digitally. I think we'll be using platforms like Zoom in the future as we are now, things like the Facebook Live to interact with our audience. I think that's been really, really positive. We've had hundreds of comments on some of those from people wanting to know answers. So I think that's given us an idea that there is the appetite for it. I also think that we will interview people digitally sometimes as well on things like Skype, because sometimes there's not a need to drive 30 or 40 miles to do an interview. You can just do it like that. As far as learning in a wider sense goes, as far as this pandemic is, I think there's no doubt that the situation with PPE and the lack of testing to begin with is something that does need to be looked at. I went into a couple of care homes early on in the pandemic, and one of the owners had to drive to Manchester to get his gowns and masks, and that's pretty unbelievable that we'd have to drive that far personally to try and source something. That can't be right. Another care home that I went into, I didn't say anything, but they had their masks on inside out, and that just showed, a lack of understanding about how to use the equipment. Now, most care homes would have gone through full training, but there are ones that just felt they weren't getting the appropriate information. And I also think that the way that care homes and the social care system has been treated in this pandemic needs to be looked at. There's been a recent study by the university that proves that the lack of PPE at the beginning of the pandemic did contribute to the spread of the virus in care homes, particularly locally. And I think it's the fact that social care and care homes do need to be seen on a level with the NHS. You know, they are just as important. It's really important, as we know, to prevent the spread in the community of the virus. And I think, you know, more emphasis at the beginning was placed on hospitals getting the right PPE and hospitals having ventilators. And there wasn't quite enough on making sure that care homes, where there are really vulnerable elderly people, had the right equipment in place, had the right training in place, and could deal with the situation comfortably and confidently. So I think that's something that will be looked at in the future. But I think there's also positives that have come out of this. I think people have, you know, really reprioritised their lives. People, you know, haven't been as affected, but have just been working from home. I went to a GP surgery in Stowmarket the other day, and one of the GPs said that they'd actually seen a doubling in the pregnancy rate. So they were expecting a baby boom in January, February next year. So she just seems to think that it's down to people reassessing their lifestyles, really, and realising in this terrible time that families are so important. So, you know, there are positives that have come out of this as well.
Yeah. Thank you, Nikki. I completely agree that there needs to be more equity across social care and the NHS, because they actually they depend on each other. So that's needed for that sake alone. And I'll make sure I pre-warn all the local maternity services about the first quarter of next year.
Yeah, you heard it here first.
Yeah. Thanks, Nikki. Thank you very much for your time.
Pleasure.